Our patient is here from Virginia. His back is killing him. He has back pain. We determined that the pain is most likely coming from the L4-5 disc. He has an annular tear and a small bulging disc. Just relax, you're doing great. Num. We're going to give him a little bit of numbing medicine, and we're going to perform a discogram on this gentleman. If you have questions, feel free to ask. Anthony will relay your question to me. In the meantime, while we're gaining access to L4-5, Anthony, can you show us how a disc injury causes so much back pain? Shot.
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6.
Come back. So the disc becomes injured through trauma. People traumatize their disc. And when you traumatize your disc, you're actually tearing the ligament that holds the bones above to the bones below. So here's a bone above. We'll call this L4, which it is. And then you got a bone down below, which is L5. All right, and these are bones, okay? Bones are obviously hard. It's very hard to damage a bone. Now, between these bones is what's called the disc. This is the L4-5 disc. And when you have a traumatic injury to your spine, such as a car accident, fall, sports injury, you get a tear in this ligament that holds the bones together. At the same time, you crush the nucleus. So we have two parts to the injury, all right? The injury to the disc. All right. Part one, you had ligament tear or annular tear. He's going to have fun taking off all the writing. And number two, you have a fragmentation of nucleus. Fragmentation of nucleus. That is the jelly just inside the annulus. It gets crushed, fragmented into little pieces. And over time, the fragments work their way out through the tear to make what's called the herniation. Okay? And that's what this patient has. And let's show the audience how much time you need.
How you doing, my friend? You okay?
Let's show the audience how we fix these annular tears and bulging discs with the laser surgery.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-692.
All right, welcome back. You can see how we use a laser to clean and debride the tear in the ligament between the bones, called the annular tear. We also remove all the granulation tissue and herniation that's stuck in there causing the pain. and then the body will seal that itself. It doesn't need anything else to be added. It's just natural repairing of the disc. So today is a special day. It's Jordan's birthday. He turns 18 today, and we're going to sing him happy birthday. All right, everybody ready? Let's do it. Happy birthday to you. Happy birthday to you. Happy birthday, dear Jordan. Happy birthday to you. All right, hopefully you guys heard a voice other than mine, because mine is terrible at singing. It's one thing that God did not give me as a talent for singing. Okay, so our patient is almost awake enough to perform what's called a discogram. An evocative discogram is a test that we can do to determine if a disc herniation is painful or not painful. And that's what we plan on doing with this patient. We want to do an evocative discogram. But we have to have the patient awake. And right now he's not quite awake.
Can you open your eyes for me?
So we're going to give him just another minute.
Open your eyes. We're going to ask you a question, okay? Are you having any back pain?
In the meantime, if you all have questions, feel free to type them up.
Any back pain right now? You said no on the back.
All right. Any questions from our audience?
No questions.
Now, folks, the reason why we're doing a discogram is we want to make sure that this disc injury, this herniated disc at L4-5, the disc bulge, is indeed the cause of his back pain. And the only test in the world that will confirm that is the discogram. The reason we do this is that there are 30 distinct causes of chronic back pain. And the L4-5 disc herniation is just one of 30 causes. That's the one I think he has based on his exam and my experience. But I don't know that for sure unless we test it. That's why we want to do this test. Are you having any pain?
Are you having any pain right now? He said no.
All right. You comfortable?
Are you comfortable? He said yes.
All right. How bad is that on a scale of 1 to 10? How bad?
What number?
How high did it go?
What number? 7.
What's the highest it went?
Already went up 8. He said no.
8 points it went up. What's the highest it goes? What's the highest on a scale of 1 to 10?
9.
All right. Is that where you get your pain? Yes? All right. Sorry, folks, about the yelling here, but I've got to talk to the patient. He's under the drapes. He can barely hear me. I can barely hear him. But we're going to put you back to sleep. So we just confirmed 100% that this disc right here, he said it was a 9 out of 10, but if you ask me, I think it was more like a 15 out of 10. And he sort of gave us the number after I stopped giving him the dye. But at the point where I gave pressure on the disc with the syringe, that's the evocative part, I think it was closer to like a 15 or 20 out of 10. He was writhing on the table. So clearly painful. And when I asked him, is that where you get your pain? He said yes. So we call that concordant. So we have found the source of his pain. He's herniated this disc, and we're going to go in and fix it. Now we're putting our patient to sleep. We're going to make a small incision, and we're going to use the laser like we showed you, performing laser spine surgery to fix this disc. While we're getting ready to get in with the endoscope, why don't you show the audience the 30 different causes of chronic back pain that are all fixable here at Deuk Spine Institute. I'm Dr. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. Okay, welcome back. You see from our video, there are 30 very distinct and different causes of back pain. Each cause has to have its own treatment. If the L4-5 disc is causing the back pain like it is in this patient, then we have to treat the L4-5 disc. If the facet joint at L3-4 on the left side is causing the pain, then we have to treat the facet joint on the left side at L3-4. Deuk Spine Institute is the first spine clinic in the world to offer tailored treatment to specific causes of back pain. Other doctors just do fusions. They fuse your whole spine, and they fuse areas that don't need to be fused. or they offer you spinal cord stimulators or procedures that don't work because they're not treating the source of pain. When you're tired of going to the doctor and living in pain and having it pain treated where it gets better with a shot or pill for a few hours or a few days, and you want permanent relief of pain, come to Deuk Spine Institute. We'll give you permanent pain relief. But that's because we have treatments that nobody else in the world has. You're watching one of those treatments right now. This patient had back pain, and actually what's quite interesting about his story, we got an MRI. It showed that he had a torn muscle in his lower back on the left side, a torn muscle. So we treated him for a muscle tear, and 2 weeks later, after muscle relaxers, he still had horrific pain, couldn't walk, couldn't get out of bed, had tremendous pain in his lower back. And I said, you know, it just doesn't sound like it's the muscle tear, because a muscle tear, it always heals up after a short period of time. Like, the pain gets better if you rest it and you don't use it and you take muscle relaxers and you use hot and cold packs, which is what he did. But the pain was not getting better. It was getting better with the relaxer, but only the muscular pain was getting better. But he felt there was a deep pain deep inside his back. So I reevaluated this patient and found that he had indeed a small bulging disc, but it was very hard to see on the MRI. It was in the foramen, and it was right against the pedicle. So I said, you do have it. We could do surgery and see if it helps. And I think that's your best option. So he trusted us, came here to Deuk Spine from Virginia, and we're doing his surgery. And guess what, folks? We just tested this disc, and guess what? It's painful. It's a 9 out of 10 in pain. So it is the cause of his pain. I can see inflammation here. Inflammation is actually what's causing the pain itself, but what causes the inflammation is the herniation. So his herniated disc at L4-L5 is what's causing inflammation, and the inflammation is what's causing his back pain. Any questions from our audience?
No questions?
All right, now this patient certainly could have stayed in Virginia and had spine surgeons do his treatment up there. They would have done fusion or laminectomies, and he chose to come to Deuk Spine instead. Okay, so let's show everybody why Deuk Spine Institute's treatments are better than what other doctors are offering. Hold it. Hi, I'm Dr. Deukmedjian. We've just completed our free MRI review at Deuk Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Deuk Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Deuk laser disc repair. We've been performing the Deuk laser disc repair since 2006 here at the Deuk Spine Institute. To date, we've had 0 complications. The Deuk laser disc repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Deuk laser disc repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Deuk laser disc repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Deuk laser disc repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Deuk laser disc repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Deuk laser disc repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Deuk Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. We are just about done fixing this herniation on this patient, and we're going to be closing up in just about a minute. I'm just fighting one last bit, and remember, once I clean out this herniation from the tear, like you saw in the video, this patient's body will literally seal this area himself. As a matter of fact, he's trying to seal it, If you look carefully, you'll see a pink color. The pink is his body inflammatory system trying to seal this area up. Okay? It's a very faint pink color. So he's got good blood supply here. And here's the top. Here's 12 o'clock. This is where the medial component is. There's a bone spur right there. That bone spur got pushed out into the foramen. But you can see all the scar tissue. His body attempting to heal this, but unsuccessful. And that's what we typically see. I had a telemed call last week with a guy from England who got into an argument with me about herniated discs. And he said, "Doctor, if I just don't do anything, leave my herniation alone, my body will clear it out on its own." And I said, "No, it doesn't work that way." I said, "That's what you can see on the internet. There's a lot of misinformation, where there are websites telling people that if they do chiropractic care, physical therapy, that their bodies will heal the herniation on its own." But that's not what happens. The herniation stays there. And he told me that I was basically crazy and that I was a liar. And let's just say that I just had to say goodbye. But this guy just wanted to argue with me.
Why is he the telehead? Just argue?
He was there to argue with me. That's it. He just wanted to argue. And I ended up just saying, "Sorry, I don't agree, but I respect your opinion, but it's not the truth. If you don't agree, it's fine. I'm not there to argue with people. I'm not there to convince you. I'm there to give you my opinion. That's why we do telemed." I have 30 seconds. I'm literally just about done. Why? How much irrigation is left? Yeah, we're fine. Do not respike. All right, if there's no other questions, we're pretty much done here. And you can see scar tissue. Yes.
We have one question.
Sure.
We have a question from Cozy McKnight on YouTube.
Welcome.
My nerve conduction study results say I have a carpal tunnel-like nerve in my wrists, hands, and fingers. My neck also hurts at C1. Can this be coming from my neck, and can this be fixed?
That's a great question. First of all, thanks for joining us. I just want to show you guys real quick before I answer that. Bring that here. Bring that all the way here. Look at all these pieces of herniation that came out. You guys see all this?
Yes, we do.
So each of these is a piece of herniation. There's a good size one right there. All right, take it away. We did all this surgery through a small incision that's just about 7 millimeters. How's blood pressure?
Perfect. No, okay. Except for one second.
All right. Because he's oozing a little bit. I'm going to keep pressure here while we're talking. To answer your question, it's impossible for anyone to make a diagnosis based on the description you just gave us, okay? And if you want to know why you're having pain, the best thing to do is do a virtual consultation. Give us your MRI scan. We're going to want to see the actual images. We're going to want to see the report, both images and report. And then I will spend 10 minutes with you on Zoom, and I will tell you exactly why you're having pain. Okay? But carpal tunnel will never cause neck pain. It only causes numbness and tingling in the fingers, period. It never causes neck pain. Put pressure here. Okay, nice and hard. All right, the whole surgery is done through this small incision. And he's going to go home in an hour. In his case, since he's coming from Virginia, he's going to go home probably tomorrow after we check him out in the morning. But he'll go back to his hotel tonight. So thanks for joining us. Are there any other questions?
Yes. We have a question from Seta Pathy on YouTube.
Hi there. Welcome.
What is the most interesting case you have done?
What's the most interesting case I've done? Well, for those of you, you know that I'm a neurosurgeon. Neurosurgeons, we do all kinds of surgery. We do back surgery, neck surgery, brain surgery, peripheral nerve surgery. The most interesting case I ever did Probably aneurysm surgery, clipping aneurysms in people's brains before they ruptured. I like those. So if somebody has an aneurysm and it's going to burst, we want to go in there and put a little metal clip on it or coil it before it bursts, because once it bursts, it can kill the person. Put a pressure dressing. I think probably the aneurysm surgeries were my favorite. I also did a lot of epilepsy surgery on the brain during my residency and fellowship, and I really enjoyed epilepsy surgery. But I'd have to say the most interesting for me was aneurysm clipping, like a middle cerebral artery aneurysm or an ACOM aneurysm or a posterior communicating artery aneurysm. We did a basilar apex aneurysm clipping with Art Day a couple of times. That was really exciting. The problem with those surgeries, though, to be honest, is they take 8 hours to do the surgery, maybe 10 hours. Those are really complex surgeries. But it takes an entire team of people. We don't do that here at Deuk Spine. I would not be the best person to clip an aneurysm anymore. There are much better doctors than me. But when it comes to fixing people's back pain and neck pain, there's nobody better in the world than Deuk Spine Institute. Thanks for joining us. I hope that answers your question. Are there any other questions?
Yes, another question from Seta Pathy. Is your fellowship in neurovascular surgery? I heard most surgeons in your field do this.
My fellowship that I performed or the fellowship that we offer? Deuk Spine Institute offers a fellowship, but it's in endoscopic spine surgery and pain management. But the fellowship that I did a fellowship in cranial surgery with University of Florida, and I was NIH funded because I was a principal investigator for a project studying epilepsy in cortical dysplasia. So my fellowship was heavy in cranial surgery, where I did a lot of brain surgery. The one that I did myself. And then I did many fellowships in spine. All right, any other questions?
No questions.
Thanks for joining us. Our next patient today has bilateral piriformis syndrome, bilateral sacroiliac joint pain. And she came to us recommended by another patient who we treated in the past. And she said the other doctor was recommending fusion of her SI joint. And she did not want the fusion. She heard bad things about the fusion of the SI joint. So she came here. We're going to perform our Deuk plasma rhizotomy, both SI joints, and our bilateral piriformis muscle release. That'll be next. Thanks for joining us. Have a nice day. And good morning, Dr. Deukmedjian. It's July 17, 2024. I'm here with one of my Floridian patients from Punta Gorda. He just had his lower back fixed with two procedures, the Deuk laser disc repair for some bad discs and the Deuk plasma rhizotomy for facet joint pain, which we discovered when he showed up here and I examined him and found his facet joints were hurting him. You just had your surgery yesterday. You can see in the video, we went in and cleaned out two discs and got the pressure off the nerves. We also did the Deuk plasma rhizotomy on your facet joints and destroyed the pain nerves. How do you feel today?
I feel good. Yeah, I don't have any pain.
So the surgery helped?
Oh yes, surgery definitely helped. Yeah.
What was life like for you before the surgery? Why did you decide to have it?
I couldn't do anything. I couldn't walk. I still try to get around a little bit because I'm general contractor and I try to help my son out. I help the last, I'd say 6-8 months I've been in my chair and that's it. Watching TV and that's about it.
Because of the pain in the back?
Because of pain, and yeah.
And you've had a rough time because you had some fractures in your spine which had kyphoplasty cement put in, which looked good. And then the discs were the problem now, as well as your facet joints. And we were able to fix those yesterday.
Yes, I went to a different doctor over in Fort Myers who did the cement jobs. I thought that's all I needed. That's what one doctor said. Oh yeah, you just got these 4 fractures, I guess.
Yes.
Yeah, we'll fix that. You'll be fine. Well, it didn't do anything when he fixed that.
Well, and now you notice a difference.
Yes, definitely.
And you're not on any new pain medication that we gave you.
Well, I haven't taken any pain medicine.
No pain medicine.
No.
And you're still feeling like the pain is gone. So yeah, I believe it worked well.
Yes.
Anything you want to say to your friends or family out there?
No, I'd definitely recommend Dr. Deuk if for someone who has a back problem. Certainly, this disc laser surgery, I guess, is he's the only one that does it. Seems to be the best way to do it. Like I say, I would recommend it. And a matter of fact, I have a cousin that has been having problems for quite a while, and when he gets back down here, he's coming back to Florida. I'm going to have him call Dr. Deuk, see if he can set up something.
Yeah, we'll take care of him. Don't worry. What's his name?
Kent LeDuc.
We'll look for Ken Leduc. All right, sir. Well, enjoy life. Get those muscles back in shape. If you need anything, you call me. You have my cell phone.
Oh, thank you very much.
You're welcome.
Yep,
You're welcome. Thank you.